Hello everyone and welcome back to another session of Q&A with DS. All right, so you might see some of the kitties running around. They might jump up and say hi. I hope you guys enjoy that. All right, so let's jump right in, shall we? Because we got a lot to answer. So this month's questions, most common questions are, why my teeth sensitive after TRP? TRP is the scaling and root planing therapy that I referred to in my other video that I spoke about. And it is a type of treatment that we typically do on a patient that has bone loss, and patient that has gum infection, and patient that has high bacteria count. And the perio chart measurements, which I talked about in my POP video, is 6 millimeter or more, so TRP. So why teeth are sensitive after the treatment, since we are only treating the gums? That's a really good question. And the reason why is when we flush out that area, flush out the bacteria, clean out the calculus and clean out the plaque, we are desensitizing the area from whether the gum infection or the gum inflammation, soreness, but also we're disinfecting the area. We are, changing the environment of the mouth by removing the bacteria biowaste from those pockets and changing the condition and environment of the mouth to rebuild itself into a healthier environment. So the reason why sensitivity, the sensitivity actually is not coming from the tooth, it's coming from the area around the tooth, which is gums and soft tissue and fibers that surrounds the tooth itself. So it's not tooth sensitivity per se, it's just gum sensitivity. And just like anything else, like even if you had surgery, you're gonna be sore. You're gonna be, you feel that somebody was there cleaning out or making things better. So just take ibuprofen, take some Motrin. If it doesn't subside within 48 hours, please give us a call. And typically we send you guys with the prescription mouth rinse that you need to rinse twice a day for at least 2 weeks, depending on the case. And that could calm or should calm the area down a little bit better. So to answer the question, sensitivity is not tooth sensitivity, is because we're in there. It's an invasive procedure, but there's no cutting or bleeding or anything like that. You might bleed when you're there, but not like when you get home. All right, on to the next question. What are the white spot on my teeth? That's a very good question, and I get it so often. There are a couple of reasons. The most common reason, or the most common cases that I see, is after braces, especially for patients that's been in braces for 3-4 years. I have patients that had ortho for 4.5 years. And what that does, having the cement on the tooth and then the hardware, which is a bracket and the wire on top of that, not all of us are very good at keeping everything clean and keeping everything lubricated and moisturized while we are in braces. And that's why I love Invisalign, because it's removable and you can take it out, you can do desensitizing, you can put fluoride on top of it. But unfortunately, when you do conventional ortho or braces, it's hard to do that. It's hard to maintain the enamel under all that hardware, especially if you're wearing it for 3-4 years. My brother was one of them. He had a palatal expander, then he had braces for a while, and at age 30 something, he still had cement on his enamel that I had to remove. So number one, leaving cement behind, and number two, over drying or not having the enamel soaking in saliva because you have the cement and the bracket on top of it, makes the enamel super dry and the enamel starts breaking down. And we actually can see the impression of the brackets on the teeth after the braces are off. Or it could be trauma that the child, when you're 4 or 6 years old, you fell down on that area, and underneath, while the new tooth is developing, it got traumatized and then somehow interfered with enamel development It could be also from in utero, you know, as a fetus. It could be something interfered with the enamel predisposition or development. So it's benign. It's not hurting the enamel. Also, the white chalky spots could be over fluoride too. You know, if it's too much, you know, fluoride or early fluoride, you'll have some, you know, fluoride spots. There are other spots too. There are yellow spots too. There are brown spots within the enamel itself, but that's another question. But they are benign. It's aesthetics. A lot of patients don't like them, and they want us to remove them, especially if it's at the front. It's usually at the front, not much in the back. And what we do, we have to like burr it out and then put some composite, you know, on top just to make it look nice. But we definitely keep an eye on spots like that, and we make sure if it's not fluoride related, we make sure that everything is clean and the tooth gets enough fluoride to keep, again, fluoride remineralizes the enamel. I hope that helped. I know it's a long answer, but that's what happened when you ask Dr. Slava. It's never a short answer. Next question. What are the dark spots on my teeth? Okay, so this must be my hygienist wrote those down back to back. All right, so I just said that the spots don't have to, I just said that the spots don't have to be white. Sometimes they're brown, sometimes they are darker. So those typically stains, coffee stain, smoking stain, dehydration, like I said, not drink enough water could be preservative, or coloring stain. I guess the cats don't want to say hi today for some reason. But when I was setting up, they were all over the place. Anywho, that's a cat life for you, or that's a cat nature personality for you. Again, they're benign, they don't hurt the tooth. However, if we see a pattern in the mouth, there's so many dark spots on the teeth, we have to watch and monitor those spots very carefully, because if you don't clean the stain, or you don't keep the stain clean, it will turn into decay and it starts breaking, the tooth starts breaking down. And then you have a cavity. Yes, and I have to drill. Yes, and I have to fill. Yes, I have to give you Novocaine. All yeses, unfortunately. But, you know, dark spot sealed enamel is okay. Dark spot open enamel, that's not okay. And that's basically, if it's open spot, it's deterioration or breakdown of the tooth. All right, we have time for one more question. Don't be greedy. All right, why is my crown rough? Okay, so it depends. Is it a plastic crown, which is a temporary crown? It's made of plastic. It's always going to be rough. Just live with it for 2 weeks. It's only 2 weeks. And I know the tongue is going to drive you crazy, rubbing against it. It's going to make your tongue very, very sore, but we don't want the tongue to be sore, because that's very annoying and very uncomfortable. Please come back and go back and let's smooth it out. Now, if the permanent crown is rough, is it rough because it's broken, chipped, sharp, or could be the way they glazed the crown? It's not fully glazed and you can feel the chalkiness of the material underneath. That is something that we should examine and look at. Every cases that come from the lab, we open them up, we check them out and make sure everything is right, the way it should look, the way it should feel before we even, get you in and put the crown. At least that's what we do. But if we see any like quality or deficiency in the way the material is, we will definitely reschedule you. We send the crown back and to get redone, either reglazed or if it's chipped. Now, if we put the crown in and you guys chip it or break it, then it becomes sharp and rough. Now, that's very common with the PFM, which is porcelain on top of a metal crown. So way back in the day, we used to make crowns out of a metal tooth, and then we glaze porcelain on top of it. That chips really, really easily, and that's why we stopped doing it, and now we went to zirconia. And I used to see it all the time, and it will break, it will chip, and then the metal underneath is very rough because it's etched. They etch the metal crown before they put the porcelain on. Okay, that's it for today's segment of Q&A with Dr. Slava, and I will catch you on the next video. I apologize, the cats are napping. No cats this time. I'll see you next month.